Hello friends, I'm Dr. Parul Sathe. I'm obstetrician, gynecologist and fertility specialist. I'm practicing at Viviana Clinic, Kharkar. I'm attached to Apollo and Motherhood Hospitals. Today we will talk about preterm labor. Before knowing preterm labor, what we should know is what is normal term labor and what is preterm. When a girl comes to us, the date of delivery which we give to her is 40 weeks from the first day of last menstrual period. The delivery anytime after 37 weeks is normal, labeled as normal term labor. Usually, baby delivered after 37 weeks is a healthy baby. But if the delivery occurs before 37 weeks, then it is labeled as preterm labor, and chances of complications to babies are high in preterm deliveries. So, this is very important that you should know that you are at high risk of preterm delivery, and when it is the time when you should approach your obstetrician as early as possible so that you can be treated for the same and we can help you. So, high risk factors for preterm delivery include: number one, if you have history of preterm delivery in first pregnancy, then you are at high risk of delivering preterm again. If there was any history of trauma or any surgery done on your cervix, on the mouth of your uterus, maybe due to first delivery, maybe due to some other reason, then chances of preterm delivery are high. If there are twin pregnancies or triplet pregnancies, chances of preterm delivery are high. If there are any abnormalities in the womb, what we call as septate uterus, biconjugate uterus, chances of preterm delivery increase. If the girl is smoking, chances of preterm delivery is high. If the girl is anemic, if her hemoglobin is on lower side, if the girl's weight before pregnancy is very low, if her BMI is low, chances of preterm delivery are again high. So these are the high risk factors, and some of which can be prevented. So please, before conceiving, maintain a healthy weight, healthy pregnancy. That is what we want. So girls, during labor or during pregnancy, infection is one of the most common causes of preterm labor. Chances of preterm delivery in India are 10 to 15%, which is very high. And the complications which such babies face are sometimes breathing problems, sometimes vision problems, sometimes developmental delays. So it is always better that if you have any high risk factor for preterm delivery, please talk to your obstetrician. Then your obstetrician will monitor you by frequent sonographies, by examining you internally. If there is any infection, your obstetrician will treat you. Now, how will you come to know that you are going into preterm labor? Sometimes a girl starts developing pain in abdomen before 37 weeks. Labor pain usually comes and it goes. Then it again comes and it goes. And it increases in intensity and frequency every time it comes. This is the time when you have to approach your gynecologist as early as possible. Sometimes girls feel only heaviness in lower abdomen. If there is any such symptom, please share it with your obstetrician. She will examine you from inside, and maybe the mouth of the uterus is opening, and that is one of the reasons for this. So if we detect it early, we can help you, we can give you injections and medicines so that the baby can be mature before time, and we try to treat the infection and we try to postpone the delivery at least for 48 hours so that we can give medicines to help baby survive and to prevent the complications. So it is my advice to you, sincere advice. Please try and understand the symptoms of preterm labor and approach your obstetrician as early as possible. Thank you.